Continuing with Objective 5, now we're going to define, pronounce, and spell diagnostic terms related to the cardiovascular and lymphatic systems and blood. So first, of course, we're going to start with the terms built from word parts. So starting with the cardiovascular system, angiography, radiographic imaging of blood vessels, angioscope, the instrument used for visual examination of the inside of a blood vessel, angioscopy, visual examination of the inside of a blood vessel, aortogram, radiographic image of the aorta, arteriogram, radiographic image of the artery, venogram, radiographic image of a vein. Then we have cardiovascular procedures, echocardiogram, record of the heart structure and motion using sound waves, electrocardiogram, record of the electrical activity of the heart, electrocardiograph, the instrument used to record the electrical activity of the heart, electrocardiography, process of recording the electrical activity of the heart. So here is a sample of what a normal electrocardiogram should look like. Again, it could be abbreviated ECG or EKG. And then we have diagnostic terms not built from word parts, digital subtraction angiography, process of digital radiographic imaging of the blood vessels that subtracts or removes structures not being studied, Doppler ultrasound, study that uses high-frequency sound waves for detection of blood flow within the vessels, used to assess intermittent claudication, deep vein thrombosis, and other blood flow abnormalities. Systemimbi test, nuclear medicine tests used to diagnose coronary artery disease and assess revascularization after coronary artery bypass surgery. Single photon emission computed tomography, nuclear medicine scan that visualizes the heart from several different angles, producing three-dimensional images used to assess damage to cardiac tissue. Transesophageal echocardiogram, ultrasound test that examines cardiac function and structure by using an ultrasound probe placed in the esophagus, which provides more direct views of the heart muscles. Cardiac catheterization, diagnostic procedure performed by passing a catheter into the heart from a blood vessel in the groin or arm to examine the condition of the heart and surrounding blood vessels, used to diagnose and treat cardiovascular conditions such as coronary artery disease. Exercise stress test, study that evaluates cardiac function during physical stress by riding a bike or walking on a treadmill. Blood pressure, pressure exerted by the blood against the blood vessel walls. The blood pressure measurement, written as systolic pressure 120 and diastolic pressure 80, is commonly referred to as 120/80. Pulse, contraction of the heart, which can be felt with a fingertip. The pulse is most commonly felt over the radial artery, which is in the wrist. Sphygmomanometer, device used for measuring blood pressure. C radioactive protein, blood test to measure the amount of C radioactive protein in the blood, which when elevated indicates inflammation in the body. It is sometimes used in assessing the risk of cardiovascular disease. Creatine phosphokinase, blood test used to measure the level of creatine phosphokinase, or an enzyme of heart and skeletal muscle released in the blood after muscle injury or necrosis. Lipid profile, blood tests used to measure the amount and type of lipids, which are fat-like substances, in a sample of blood. Troponin, blood test that measures troponin, a heart muscle enzyme. Troponins are released into the blood approximately 3 hours after necrosis of the heart muscle and may remain elevated from 7 to 10 days. Activated partial thromboblastin test, blood tests used to measure anticoagulation therapy for patients taking heparin, which is an intravenous anticoagulant medication. Coagulation time, blood test to determine the time it takes for blood to form a clot. Complete blood count and differential, lab test for basic blood screening that measures various aspects of erythrocytes, leukocytes, and thrombocytes. This automated test quickly provides a tremendous amount of information about the blood. Hematocrit, percentage of a blood sample that is composed of erythrocytes. It is used to diagnose and evaluate anemic patients. Hemoglobin, blood test that measures the amount of hemoglobin, which is a protein in red blood cells that carries oxygen in the blood. Prothrombin time, blood tests used to determine certain coagulation activity defects and to monitor anticoagulation therapy for patients taking warfarin, which is an oral anticoagulation medicine. Alright, so just a few more pictures. Here is the sphygmomanometer that they are using to take the patient's blood pressure, and here's the stethoscope they are using as well. And then we have one review question, which measures the number of times per minute the heartbeat is felt on the arterial wall. So hopefully you chose C for pulse, and that will end this recording.